Welcome back to Living 757. Quincy, you know that this is the second highest season for hurricanes, and with so many storms in the ocean, we need to know how we can prepare for this season. So let's welcome Edward Warner, Director, Response and Recovery Division from the Virginia Department of Emergency Management. Welcome, Ed.
Thank you, Patricia. Thanks, Quincy.
Hey, now we just came back from the outside and it's a beautiful day, but we know that it's not like that out in the ocean. So for the state of Virginia, what goes into preparation for us if we're in danger of a hurricane hitting?
It is a year-long process, and we do things like emergency management is kind of sequential. So everything starts at the local level to begin with, and as you know, most localities have their own emergency manager that works there to prepare the city itself. From the state level, we do a lot of interchange between all the state agencies. As you might know, that VDEM is the primary organizer, primary coordinator for every other state agency during a disaster. So whether it's VDH, whether it's VDOT, whether it's any of the other state agencies, we do a lot, or we coordinate all of those responses as they go. Okay. I want to point out, though, that it's also up to every individual to be able to be prepared for this kind of thing. And some of the things that you have to know or have to do, make an emergency plan, do things for your family to have a plan in case of an emergency. Know your evacuation zones. It's a big one too, especially down in the Tidewater area, because the governor might, given where the storm trajectory is coming from and given some of the circumstances, order a mandatory evacuation as was happened last year during Florence, or 2 years ago, I believe. Boy, the time flies. Skip stuff like important documents. Make sure that you have something that's easily transportable that you can take out of your house and take with you. Get tech savvy. Make sure that everybody knows your stuff is charged up. That you have communication protocols with all your family members, and especially those family members that might have some needed assistance, whether it's older parents, whether it's younger children, that kind of thing. Make sure that you have them as part of your plan to be able to check up with them.
Okay.
That's a great list, because when you're in a hurry, sometimes you're not prepared for those events, and then, like you just mentioned, documents are very important. And I know you guys work hand in hand with FEMA in a disaster. Do you also have programs for this disaster after this happened? How can people have access to these programs?
Absolutely. The programs themselves, again, it's kind of at a very local level. If FEMA gets involved, we really have had a hard time. And just as an example, the last time that FEMA was involved in an individual assistance situation was Hurricane Michael almost 3 years ago. Again, just to emphasize personal preparedness, the maximum grant that FEMA can give anybody in an individual situation is somewhere around $22,500. That seems like a lot, but if you've lost your home, if you lost the contents of your home, all that's not going to go very far. Make sure that
it's not a lot.
It's not a lot, and make sure you have your insurance up to date. Rental insurance is particularly important. If you live in a floodplain or a flood zone, insurance, you normally will not pay for any of the stuff that's inside the house or the house itself. So make sure that you're looking at floodplain NFIP. It's the National Floodplain Insurance Plan, and make sure you have coordinated with that well before a storm arrives.
And I have a quick question for you before we get out of here. Just what number of a category storm does a storm have to be for evacuation to be mandatory? Like, that's important to me.
It's not a science, Quincy, at all. I mean, it's the governor determines based on a number of different inputs what the trajectory of the storm is. It might be Cat 3, but it's going to glance off us, so maybe not a thing. But it might be a Cat 2 or a Cat 1 even, that has a certain wind category. And it's not so much the wind. We talk a lot about categories of wind. It's the water that is the most impactful. And if there's a situation where the wind is pushing a certain direction and you're going to get a lot of inundation, the governor might do it at a Cat 1 or even a different type of tropical storm. So it's just a question.
It depends.
exactly. It depends
It just
exactly
depends.
on the circumstances.
Thank you.
This is a
Thank
great
you.
information. Thank you so much, Ed. Thank you for your work, for what you're doing. And I know we have to get ready for this. But yes, once again, thank you so much for your time.
Thanks,
Yeah,
Patty.
thank you, Ed.
Good talking
All
to you.
right. No
Yes.
problem. Yeah, and just like natural disasters, we can also prepare to protect against cancer, and more specifically, prostate cancer, which is the most common cancer among men. Now, statistically, 1 in 9 of us will be diagnosed with it in our lifetime, but be encouraged, as September, this month is Prostate Cancer Awareness Month, so Riverside Health Systems is reminding you and me to schedule our screening. Let's take a look.
The part that was hard was my best friend. He came down with prostate cancer also. He never got tested. He told me, he said, look, this is on me. You make sure you make every treatment. So every day he would call me about 3:15. Where you at? I said, I'm leaving my treatments now. My last treatment was a Friday. We were supposed to go out to celebrate. I get a call Monday morning, he passed. But he was there with me the whole way. He wanted to make sure that I got through, and he held on long enough for me to get through.
Riverside sets itself apart for treatment of men with prostate cancer because we offer a full array of treatments for this disease. The majority of men now are not getting open surgery, but are now getting robotic surgery for removal of the prostate. And we also offer a well-rounded holistic approach, which is individualized to the patient.
My name is D'Angelo Bailey. I was diagnosed with prostate cancer November of 2018. I went in, we tested, did the blood work, did the urine sample. My PSA levels came back extremely high. My daughter was away at school, and she kind of put it together when I told her my PSA levels. We did the CT scan, found out I had a lymph node. We scheduled a biopsy, came back positive. My son, that guy was with me the whole step of the way every day. After I took the first injection, went back in a couple of weeks to retest. My PSA levels dropped from a 25 to a 7. So we did the radiation, it was 10 weeks. We continue with the Lupron injections. I just tested a week ago, and my PSA levels are undetectable. From day one, the staff made the whole process very comforting. I didn't feel like a patient. I felt like a human being, and they were there with me every step of the way. I would tell anybody, please go get tested. Do your screenings, get checkups every 6 months like you're supposed to. I do it religiously now.
It's important to understand why we have awareness months. It brings to the forefront the importance of screening for cancers. Most men who have at least 10 years life expectancy should be screened between the ages of 55 and 70. Those who are at highest risk or who have PSA tests that are trending upward would likely be screened at least once yearly. The highest risk are those with a family history, and African American men are also at higher risk for developing prostate cancer diagnosis, but also more aggressive forms of prostate cancer. Prostate cancer can be asymptomatic. It can present with no symptoms. That's why it's important to get screening, because if a cancer were to develop, you may never know it. However, there are certain symptoms that should prompt you to seek the evaluation from your primary care or to get a referral to a urologist. This could include weight changes, loss of weight, fevers, chills, pain in the low back, spinal area or some of the bones. Also urinary problems, difficulty emptying your bladder, weaker urinary stream, and symptoms of that sort. Prostate cancer is very treatable. Most men who do seek definitive treatment will end up either getting a cure or getting control of their disease with either surgery or radiation therapy. Most men live long, healthy lives.
Very, very, very tight, very good information for us all here, especially Black men. So if you are out there, definitely men of color, we are some of the highest ones affected. So take your time today and get your screening by visiting riversideonline.com prostate screening, or you can call the number right there on the screen right there. So very important to keep your health in check. People, do not forget to do that, okay? And Riverside is taking all safety precautions as well, okay? So another key to staying healthy is to laugh, and Push Comedy is back to give us another dose of that. So don't go anywhere. We'll be right back.